Hi lovely people, let's talk about perineal trauma. It's worth noting that even though sometimes we don't see that woman has had visible perineal tears and all that, we should have it in our mind that still the perineum, the perineal tissues, muscles have undergone some sort of trauma, because some have dilated, some have elongated, some have been compressed on during the second stage. But we discuss these type of tests. The first one we are going to discuss is the minor laceration. So the laceration is just usually just a crack in the labia, or there's some cracks in the perineal skin. Okay, these are not serious form of trauma. However, it can be very painful, and even though it does not require suturing, because usually it doesn't bleed. However, we have to educate the woman to observe good perineal hygiene, eat fruits and vegetable protein food to help replenish the tissues and also avoid blood infection. Now, the second type of perineal trauma is what we call the first degree tear. In the first degree tear, we have minor lacerations in the perineal skin as well as the fourchette. And the fourchette is a continuation of the labia minora when it passes posteriorly or to form skin fold known as the fourchette in the vulvar area. So now in the first degree, it's going to affect the perineal skin, and it's also going to affect the fourchette. That's first degree. Then we also have the second degree. The second degree is a tear in the skin, okay, the mucous membrane, and also the superficial pelvic floor muscles. In the event that the second degree tear is serious, it can affect the deep pelvic floor muscles or the levator ani muscles as well. Okay, now we come to the next one, which is the third degree tear. This third degree tear is a serious kind of tear. Now it involves the deep pelvic floor muscles. Okay, and aside the deep pelvic floor muscles, the tear extends posteriorly further. Okay, affecting the anterior aspect of the external anal sphincter. So third degree involves deep pelvic floor muscles and the external anal sphincter, just that is the anterior part. So when you see a question, you know what you are choosing. Now, this is a very serious type of tear. Then the fourth one is the fourth degree tear. And in fourth degree is the most severe one. Now, for fourth degree, the deep pelvic floor muscles are involved. Then it extends further to the anterior part of the rectum. And when it gets to the rectum, it affects the internal anal sphincter. This is a very severe form of perineal trauma. So for the third and the fourth, these are serious ones that has to be sutured and careful to avoid complications such as urine incontinence, rectal or rectal incontinence, cystocele, urethral cells, all the trauma, and this perineal, all these are complications of untreated pelvic trauma. And you get it. So it's a very serious thing that we have to pay attention to when we are having or caring for a laboring woman. In our next video, we are going to also talk about how we can prevent perineal trauma. Until then, remember to like, comment, share, and give us a follow. Bye.